Hello, and my name is Megan Koss. I am an occupational therapy consultant for the Autism Alliance of Michigan, and welcome to our webinar today on fine motor and autism. Feel free to refer to the Fine Motor and Autism parent tip sheet as you enjoy this presentation. Let's begin by defining motor skills. There are two different types of motor skills, gross and fine motor skills. Gross motor skills are comprised of big movement skills like rolling, crawling, walking, and running. Fine motor skills include the smaller movements of the hand that allows us to grasp, pinch, write, and manipulate items within our hand. Examples of these skills include zipping a jacket, twisting a cap, or threading a bead. Motor skills are controlled by our central nervous system. Gross and fine motor skills are used throughout each of our days, and we take these for granted. Today we are going to focus on how autism affects fine motor skills. Autism is a neurological condition. Since motor skills are controlled by our central nervous system, motor skills are often impacted by autism. There is no defining characteristic of autism, thus a spectrum. Likewise, motor skills are often impacted differently across the autism spectrum. One child with autism might have completely typical motor skills, while another child may struggle to learn to skip, jump, run, or write. Some studies suggest that autistic children could be 6 months behind in gross motor skills and 1 year behind in fine motor skills. These differences are due to differences in neurological functioning and sensory processing, such as low muscle tone, motor planning, visual motor skills, or posture. All of us learn motor skills by practicing, so autistic children do have the ability to improve their motor skills over time by practice. Fine motor skills begin developing as early as infancy. When a baby brings their hands to their mouth, they are developing eye-hand coordination. When a baby does tummy time, they are developing the strength through their hands as they push their hands onto the floor beneath them. Fine motor skills are further developed when a toddler begins to crawl and when they learn to manipulate rattles or other toys. Eventually, as a young child, we learn to zip our coat, tie our shoes, and button buttons. School-age children eventually learn to hold a pencil, write, and do smaller, finer tasks like string beads or insert coins into a vending machine slot. This course of fine motor development can be impaired in children with autism if they don't tolerate any of the mentioned activities. Some autistic babies won't bring their hands to mouth because they have oral aversion. Others won't tolerate tummy time because of the feeling of the floor or carpet beneath them, or they may feel imbalanced when on their tummies or when crawling. When people have difficulties with fine motor skills, it is usually because they have difficulties controlling and coordinating the small muscles in their hand. Additionally, if children with autism have sensory processing concerns that impair their tolerance for touching certain textures, it could inhibit their ability to tolerate touching the items required to complete a fine motor task. Fine motor skills can certainly be improved upon. Typically, parents describe these concerns to a pediatrician or neurologist during a routine appointment. They can easily refer a child to occupational therapy to assess their fine motor skills. The occupational therapist will be able to design a treatment plan that addresses your child's unique needs and make meaningful goals, like learning to write their name, zip a jacket, or open up a snack bag. The therapist will then work with your child to help develop these skills and give you some activities or exercises to complete with your child at home to further improve their skills. Like almost anything else, the earlier the fine motor skills are addressed, the better. Like we talked about before, fine motor skills develop over childhood, so as soon as they are noticed and treated, the easier it will be for the child to develop and learn the rest of their motor skills as they age. Fine motor skills in babies and toddlers can look a little different than in older children. Babies and toddlers are still developing the muscles and skills necessary for fine motor skills. Encouraging activities that build their hand muscles and expose them to different types of surfaces is vital to developing fine motor skills. Some activities you can encourage include tummy time and crawling. These positions encourage babies and toddlers to put weight through their arms and hands, which develop the small muscles in the hand necessary for dexterity. Encouraging a baby to hold a variety of different rattles will assist them in learning how different shapes and weights feel in their hand. Lastly, encouraging sensory play or touching a variety of textures will allow your child to build the tolerance necessary to hold or touch different fine motor tools. An occupational therapist can recommend the most beneficial activities to help develop fine motor skills for your child. But if you'd like to get started now, there are quite a few activities you can do using items around the home. You can hide favorite small objects like Lego bricks or action figures inside a ball of Play-Doh and have your child find it. You can have them scoop up small toys hiding within sand. If there is a favorite snack or small toy, you can put it into a container with a lid or a Ziploc bag that is closed lightly so they can successfully open it and retrieve their snack or toy. Squeeze bottles or small water guns can be used to build hand strength and develop dexterity. Construction toys like Legos or Duplo blocks help facilitate eye-hand coordination and hand strength. You can refer to this slide for other fine motor task ideas. Are you still having trouble? If you feel like your child is still having trouble with fine motor skills, it may be a good idea to request an occupational therapy evaluation. OTs can evaluate and come up with individualized strategies to develop fine motor skills and much more. For additional information, questions, and resources, please contact the Autism Alliance of Michigan. The Autism Alliance of Michigan is prepared, at no cost, to counsel, advocate, and connect families to evidence-based care and support, however long it takes. Our navigation program will connect anyone touched by autism to a free, lifelong guide with professional help and answers. Thank you for attending our webinar.